The title of the day here is World Class to Second Class. And I'd love to hear from each of you briefly, just a brief assessment of where you think the U.S. is. Are we still number one in this realm? And if we are, how big is our lead and how much has our lead shrunk? And if we're not number one, who is?
As I look at it from a business perspective, whenever we focus on a problem, it's always around, let's look at how we're going to be competitive and grow. We define the problem, we align around that problem, we incentivize to make sure that people are focused on that problem, and then we look at how we are going to build the best talent to be able to do that. And I think if we look at it from a U.S. economy standpoint and think about the case, there's still significant unmet medical needs. There's an opportunity, we heard earlier from the other panel, the importance of jobs and economics as it relates to that. I think we have to figure out how we're going to make that case and align the coalition, so to speak, and the ecosystem so that we can continue to invest and make sure that we are out in front.
So to look to the future, how can, in the face of this competition, how can we keep our leadership role? And I think it's very good for the long term if science flourishes everywhere, provided that the infrastructure for science has an open, transparent process. It has institutions that ensure ethics and scientific integrity, and there is respect for intellectual property. As long as they exist, it's very good for science that science gets supported everywhere. But currently, that's not the situation. So we have a tremendous leadership opportunity for agencies like NIH or NSF to create that ecosystem all over the world.
An issue dear to my heart was embryonic stem cell research, and President Obama has signed an order allowing that to move forward, which is an area in which we were trailing the rest of the world, and hopefully we're on a catch-up basis at this point. But just looking at this room and just the people up here and just a lot of others I either know or know of in the whole area of medical research, I don't think we're exactly bereft of the ability to continue to compete with the rest of the world. But we do need to watch out. We do need to pay attention to our basic education, our basic research structures, and then the more advanced research that goes from there.
I do think America continues to be the place where boldness and innovation and creativity are encouraged in a way that doesn't happen everywhere else, even in places that are increasing their investments in research, and we should make the most of that. I think it is still the place where our universities are the finest in the world, and that provides an opportunity, a magnet for best and brightest to get involved in research, to plunge in, to be in an environment where creativity is prized and innovation is encouraged. Our relationships with the private sector, I think in the United States, are also extremely strong and stronger all the time in terms of the way in which this ecosystem we call scientific research can be supported. So we have a lot going for us. At the same time, just when you look at what we're putting into it, the fact that we are now 6th in the world as the proportion of our GDP that goes to research and development, not first. The fact that our 15-year-olds, when tested in science and mathematics, score very far down the list of other countries in the developed world. All of those are warning signs. I believe we can look at those signs and take appropriate actions so that we don't slip further from our position of prominence. But it isn't just going to happen because we wish for it.
If we think for a minute about the kind of typical American household, typical American taxpayer, I'm not sure that they think about it this way, but they are extraordinarily generous to health sciences and the medical sciences. The typical American spends vastly more than the typical person in any other country, close to twice as much on healthcare. And it seems like from both a political perspective, but also from a well-being perspective, a question that people who are advocating for healthcare research should probably grapple with is this question of how do we reduce the waste that is in the system?
Well, we have led the world clearly, and I would argue still lead in biomedical science and innovation. Where we have not led the world is in the application of science to improve patient outcomes. So you hear it's sort of the best of times and the worst of times all the time at the same time, right? You hear people coming from all over the world to come to the U.S. because we're doing just fantastic breakthrough things that absolutely you can't get anywhere else. At the same time, you know, my dad is readmitted to the hospital because he's on a blood thinner, and a nurse calls his wife and says, give him 2 milligrams, pills. One meant one, the other heard the other. I mean, and this kind of thing goes on every single day of the week. So I do think that we have an enormous opportunity to invest in how we apply the fruits. I'm thinking of this now as precision science. Actually, many people think of that as genomics, but I'm just thinking about how do you do what doctors and other healthcare professionals are trained to do and really get excited about, which is to take everything they've learned in science and apply it to the unique circumstances, preferences, and so forth of the individual in front of them. I mean, this is what brings tears to people's eyes. It's why they went into the profession. And yet we have not invested historically in actually giving them the tools to be able to retrieve precisely what they need in real time.
If you look simply at lifespan, which I understand involves all sorts of things, you can see evidence of stagnation. If you look at some patent things, so maybe starting with Larry, but then anyone else who wants to jump in, I'd be interested in whether you buy the notion that on net we've stagnated a little bit, or whether you think that for every traffic jam there are 6 Twitters and an iPhone to more than make up for it.
We've reached a point where we need some technical advance, some basic discovery to open a door that would help us move forward. But I think for every one of those, you can find another area where we really are on the verge of breaking things open and making enormous change. So, you know, and I think that's the natural order of things. And while one can find examples, transportation's a good one. I won't ask you why you were late getting here, but it's a good one, and we've been stuck on it. But you know, I'll point to another example that's near and dear to my heart and probably affects a lot of people in the room: Alzheimer's disease. Yeah. I don't think we've ever been at a point in time when we have the tools in hand and the opportunity to make a huge impact on a disease that has enormous economic consequences, human and social consequences, and so forth. The development of tools that allow one to pre-symptomatically identify individuals who will later get the overt symptoms of Alzheimer's disease so that therapeutic trials can be initiated at a point where they actually might have some benefit is just one example. I mean, I think we could point to many, but you know, as my favorite philosopher, you know, the Italian philosopher Yogi Berra, you know, used to say, you know, the reason the future is so hard to predict is it hasn't happened yet. And, you know, so I think we're all reluctant to predict that we'll have great treatments for Alzheimer's disease in the next 5 years, but I just don't see things as gloomily as are outlined there.